If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, what is the permanent cure of type 2 diabetes available in India? Answer by Rajinder Bala. There is no permanent cure of diabetes or any disease in the world. Even common cold and cough do not have a cure. This is admitted position of all medicine sciences. Some doctors and people make false claims that they can cure diabetes. So the first step for getting permanent cure from diabetes is, do not try anything which is in public knowledge. Because that has been tried and it has failed. Others are not fools that they will miss such clear example of cure and not try them. I have been trying a cure of diabetes and all other diseases. There is a simple single link to all diseases. I am not a doctor. So what I try is not in public knowledge. I have very small set of patients, friends or quorum members. The only positive thing is that my one cure for all diseases work on all diseases except diabetes and blood pressure to show any change within a short period. But last month I made changes in my one cure for all diseases. The new version has given lot of hope in last 1 month. It is much simpler and is on similar lines. Plugging some loopholes of previous cure. Basically we have to get rid of excess and unwanted fluids in the body. Retail end, and if it makes sense to you, try it and give feedback. Drinking water with meals can improve health in following ways. This question had troubled me for more than 15 years. I changed various formats of drinking water. The best way to drink water and other liquids is with meals. The explanation of drinking water with meals is as under. When we eat food, our stomach produces acids and other enzymes to convert the food and other liquids into a paste. This paste is passed on to small intestines. Small intestine is connected to blood veins. The minerals, carbohydrates, fats, proteins, water, enzymes and other nutrients are absorbed in small intestines and moved to liver for further processing. After processing in liver, the mineralized blood is sent to kidney for balancing of the minerals. Any minerals found to be out of correct proportions are filtered out or stored in safe places for use in the future. The first benefit of this will be that blood volume will increase as more fluids will be absorbed with minerals. There may not be any fluid absorption in the absence of acids in small intestine when water is taken on empty stomach. That should help cure a varicose veins problem. It should also help improve the skin. It should remove the dark eye spots and improve eyesight. It can improve cataract as well. It can prevent prostate cancer as well. There are 1,000 of possibilities. Weight loss. When we drink water or any other liquid after more than 20 minutes after a meal, the water and other liquids are not absorbed in small intestines, in the absence of stomach acids. Stomach acids are produced only in response to food and not in response to water and other liquids. The liquids and water are passed on the large intestines. In large intestines also the excess water and vitamins are absorbed. However, the large intestine does not absorb any minerals, carbohydrates, fats and proteins. This water is passed on to intracellular fluids. No processing is done by liver and kidneys. This is kind of direct reach to the body fluids which are passed on to cells. Over a period of time, the intracellular fluids around the large intestines become devoid of most of the minerals. These fluids are also stripped off the essential glucose. In the absence of glucose, the metabolic rate falls, which causes increase in blood sugar to compensate for the lack of glucose in intracellular fluids. Not drinking any fluids except with meals will dehydrate the large intestine and surrounding areas of excess fluids. This will result in increase in metabolic rate. It will also help reduce intracellular water. Average total intracellular fluid makes up about 30 to 50 liters of fluid. That means a loss of 5 liters of intracellular fluid can be brought in about 30 days. That is the fastest and safest weight loss that is possible. The excess water reaching in large intestine is the cause for prostate problems. Read my blog for detailed explanation about the role of fluids in our body. My blog in brief. Chronic mineral imbalance in blood leads to low metabolic rate, resulting in aging and age-related diseases like blood sugar, blood pressure and heart disease, etc. To correct mineral imbalance, do hydration-dehydration cycles, and to increase resting metabolic rate, do walking and rest routines as detailed on my blog. Read my blog for more details or watch my YouTube videos at Rajinder Bala. To increase resting metabolic rate, RMR, do the following. Walk for 5 minutes at easy pace within your home in the morning. After walking, rest for 510 minutes in bed. Repeat the above 3 times in the morning, afternoon, evening and at night before sleeping. So that makes for 12 walk and rest routines, or 5 by 12 equals 60 minutes of walk for the entire period. One can do it selectively during weekdays and on working days only in the morning and at night. The idea about walking is that it mobilizes energy, and before the entire mobilized energy is spent, we rest. In such a case, a part of the mobilized energy becomes available for vital organs. Doing walking and rest routines takes care of aging-related diseases as well. Hydration-dehydration cycles. Once in 15 days, drink 200 milliliters water every hour from 7 a.m. to 6 p.m. The very next day, do not drink any fluid for the entire day. Also read my blog for a detailed explanation of how the above steps ensure perfect health. Answer by Pragna Banerjee. Type 2 diabetes mellitus is an adult-onset condition where the cells become non-responsive or resistant to the insulin. This is a complex condition, and if untreated will lead to severe complications. The most commonly used method is always the use of oral hypoglycemic drugs. After measuring the plasma glucose level, these drugs are prescribed according to the patient basis. These are different for every patient. Depends on the patient's status and need completely. Sometimes the patients have only borderline sugar level, so for them, drugs are prescribed for a short duration and advised to exercise. Then the sugar level often can be controlled and drugs can be discontinued. There is as such no permanent cure of type 2 diabetes mellitus. It's a long-term management condition. And apart from the drugs, the most important requirement for the treatment is control by the patient. The patient's need to cut down weight. Obesity is the most harmful risk factor in diabetes. A patient's need to exercise, and then maintain a proper nutrition. Carbohydrates need to be cut down. A proper diet is important. Alcohol need to be controlled. Proper sleeping and waking up habits need to be cultivated. Thus the point is that there is no permanent way to solve this condition, and the treatment occurs on a long-term basis with the help of both the doctor and the willpower of the patient himself. Answer by Atul Sehgal. Type 2 diabetes is a systematic disorder of the body caused by metabolic derangement. Its symptoms can be quelled and the body functioning can be maintained at that level. But this is possible only by taking regular medicine, body-friendly medicine on Ayurvedic lines, and proper lifestyle. Some of the important points to be observed in type 2 diabetes maintenance are given below. These can form a good regimen for best maintenance of diabetes. Please refer to the website page referenced below for more information and guidance in this regard. Footnote: Diabetes, personal health care.